What is pudendal neuralgia? That's the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. Pudendal neuralgia is a commonly, if you know about the term, chances are you probably have that. The reason I'm doing this video is because I wish people would catch it before it becomes a full-blown issue. What is happening here with pudendal neuralgia is you have the nerves coming from the lower part of your lumbar and not lumbar, your sacrum area. And then it goes through into the inside and it goes through these different landmarks within your pelvis, the ilium part of your pelvis, and then it branches off. So you've got the pudendal nerve, which is an offshoot of the sacral nerve, and then it branches into three sections. One goes to the penis and vulva, the other one goes into your anal area, and the third one goes to the space in between. So you can have entrapment, you can have irritation and inflammation of this nerve from the site of origin, which is the lower part of your spine and sacrum, all the way to those three areas that I mentioned. The issue with pudendal neuralgia is by the time they diagnose it, there's been too much time that has been spent. That's been pretty much wasted. And then there are these blocks. It has to respond positively when the nerve is blocked. And then they can say, okay, this is pudendal neuralgia. Go see a pelvic floor therapist for it. It's hard to reach certain parts depending on where the irritation is. And many times it's like, okay, you gotta live with it. So when is a good time to catch it is if you have chronic lower back pelvic pain. When I say pelvic pain, I'm not talking about pain in your penis or vagina. I'm talking about pain in the pelvic area, in the pelvis, in the SI joint. If you have chronic hip issues, those are great reasons why the pelvis itself loses its balance and stability. So all structures, not just any soft tissue like a nerve, but all structures become compromised. So if it happens to be your pudendal nerve or a branch of the nerves exiting your spine or your sacral area, then that will be the issue. Pudendal neuralgia should not be a life sentence, but it's very easy to get distracted in the course of the treatment, and a lot of time goes by, and by the time the final conclusion is made, it may be a little too late. So you're kind of have that lingering pain or pain for the rest of your life. So it's very important to catch yourself. Don't disregard pain in your sacroiliac joint, in the lumbar area, lower back area, in your hips. Don't disregard them. Don't look at them like, oh, that's not related to this thing. People should look into these things more carefully. And the most important part is to make sure you see the right person for treatment. A lot of times when you go to see a medical doctor, they write off those areas like lower back, SI, and hip problems as an orthopedic problem. So go get some physical therapy or go see a chiropractor. Well, that's not enough, because if the examination is not very much specific to rule out pudendal nerve subtle symptoms, then it's very easy to miss it, and then it becomes a huge problem. I hope this video is making you realize how important it is to see the right type of provider and to not disregard subtle symptoms as if they have no value. Sorry about that. If you have any questions, make sure you use one of the methods of contact in the description box. Contact my office. Let's talk and see what's going on. Hope this helps. Take care.